When we talk about psychotic symptoms, we would categorize them in terms of there being, we call them positive symptoms. So the kind of symptoms you have might be hallucinations. Now, what's a hallucination? Well, it's when an individual has experiences, say for example, hearing a voice or seeing something, when that perception doesn't actually exist. So the most common one would anticipate seeing with a patient would be a woman hearing voices. Now, when we talk about the woman hearing voices, what's really important is that you realize that she hears these voices through her ears. If you have a woman who says to you, I hear voices in my head, and they're not being heard through her ears, then that isn't a real hallucination. Hallucinations can occur in many modalities. So we often, as I've said, talk about women hearing voices. It may be sounds. They might hear gas being put under their door to poison them. And these are very real to them. When you're sitting with or talking with someone who is experiencing an auditory hallucination, what you may notice is they start responding. They'll look away, or they'll turn, or they'll jump, and you'll say, what is that? What are you hearing? Or you can say to them, what happened there? And they may just move their eyes. You'll see them move their eyes and then move their head. So when you're sitting with someone or talking with someone, it's important to just look at their demeanour. Delusional idea is a false idea. It doesn't really fit into any current cultural, religious or intellectual norms. It's not, you can't argue or discuss or logically take the person away from that view. So when someone has a delusional idea, they're usually very difficult to understand. So we often categorize the delusional idea. So we might talk about someone having a grandiose idea, where they will think that they have special powers. So a woman might say, well, I can fly. And she can obviously put herself at harm, because she'll say, I don't have to walk down the stairs, I can just go out the window because I can fly. There may be religious delusions. So they'll be out of sync with the cultural norms. So while, for example, an interest, a belief in black magic is not uncommon in many cultural groups, if a woman who hasn't had any links with, who isn't part of a culture that believes in black magic, starts talking about it, feels a spell is being put on her, feels she's in danger because of that, is very convinced that the people in the house next door or her mother-in-law is putting a spell on her or wanting to harm her, then you would start to become very worried. The other psychotic symptoms that one would inquire about or maybe observe is something what we call ideas of reference, where mother may have an experience that the television is talking about her. So she says, I don't watch television because every time I turn it on, they're talking to me or talking about me. And she will hear and perceive them as talking directly about her. She may stop going out because when she walks down the street, she feels that people are talking about her, referring to her, and that is intimidating for her. Other psychotic experiences include what we call passivity phenomena. This is where the individual believes that their thoughts or their behaviours are being controlled by someone else. So when we talk about passivity of thought, the kind of question one might ask a woman would be, do you feel anyone is putting thoughts into your head, or taking thoughts out of your head, or that anyone can hear your thoughts? So the woman might have an experience that my thoughts are being controlled, they're not my thoughts, I don't have these thoughts. Such and such a person is putting them in my head. Or they may have their thoughts broadcast. They say, well, you know what I'm thinking because you can hear them. My thoughts are out there in the ether, and so you can hear what my thoughts are. And then there's passivity phenomena in terms of actions, so we call it made acts, where a woman may walk down the ward and she'll say, well, I didn't do that. Somebody was controlling me and made me walk down the ward.